Good morning. Thank you for starting your day with Good Day Charlotte.
FOX46 getting results now for your health. September is PCOS Awareness Month, which stands for Polycystic Ovarian Syndrome, the most common female hormone disorder, and it affects about 1 in 10 women. Joining us this morning to discuss, Dr. Deb Matthew, and I could talk to you, I feel like, the rest of the show about this. We only have a couple minutes, though, so we're going to cut right to it, because this is something that we're seeing more and more, it feels like anyway. Are more women being diagnosed? Do more women have it, I should say, or are we just hearing more about it because it's more on people's radar?
Yeah, you know, it's hard to say because there's actually a lot of women who have this problem and they've never been diagnosed. They have no idea. They've never even heard of this. So it may be that as more women are becoming aware that we're making better diagnoses.
And we have a couple celebrities who have come out recently and said, I have PCOS. This is something I suffer from myself. Some that you would not necessarily expect. They don't necessarily fit the standard, typical patient of PCOS. We have a couple of the folks here. We can show you some of those celebrities. And while we do that, can you explain exactly what it is in the first place? What is PCOS?
Yeah. So PCOS is a hormonal problem that causes a lot of common symptoms. So some of the common symptoms are acne, and it's a kind of acne that doesn't go away just because you're not a teenager anymore. Also, hair growth in the wrong places, like on your face, on your chest, the places you don't want it. Scalp hair loss, kind of in male pattern baldness sort of areas. Weight gain is one of the really common things that women struggle with. And also irregular periods. So you can have periods that just last on and on all the time, or you can have barely any periods. In fact, you could have no periods at all. And so this combination of symptoms is what we call PCOS. So
Leah Michelle is one of the celebrities who has come out recently and said that she has PCOS. She was, you know her from Glee, probably. Victoria Beckham is another name.
Yeah.
For Leah Michelle in particular, she talked about, I read in one of the articles where she discussed, and she said, you know, her symptoms were not as drastic as some other women, so she didn't want to come out and kind of seem like, make it seem like a big deal to women, because she didn't, because she didn't want people to think, well, my symptoms are different. It does play out differently for everyone, right?
Yeah, it does. So some women have minor symptoms and they really kind of go undiagnosed until they try to become pregnant, and sometimes fertility can be an issue, and often that's when it becomes diagnosed. On the other hand, it can start right at puberty. So like 11-year-old girls can start to have trouble with hair growth and with their weight and things like that. So there really is a wide spectrum of how severely women are affected.
And certainly when you think about the fact that it could affect your fertility, the earlier you are diagnosed, the better, right? So if you think, if you are experiencing these types of symptoms, you can ask for an actual blood test to be performed with your doctor, right?
Go see your doctor. Your doctor can take your history and do some tests, and they can make the proper diagnosis for you so that you can get the help that you need.
Very, very good advice here, and a pretty simple way to come up with a solution for something that can just seem like a really troubling issue for a lot of women. Dr. Deb Matthews, thank you so much for coming in. Always appreciate your insight.